This video will take you through the steps to set up and operate your Farrell valve system. The Avanos Farrell valve closed enteral decompression system with end-fit connectors is a closed reservoir system intended to allow the evacuation of excess gas, such as gastric distension or bloating, and drainage and collection of enteral feeding formula and gastrointestinal tract contents from patients utilizing an enteral device. Warning: for enteral use only, do not administer IV medications through this enteral device. When the Farrell tubing line is open, as indicated by an open white clamp, the pump's occlude alarm will not function, as formula will continue to flow into the Farrell bag. Caution: while the Farrell valve is in operation, flow to the patient is essentially controlled by gravity. With normal or non-Farrell operation, pump pressure of 12 to 18 psi or 83 to 124 kPa may overcome and clear occlusions or kinks in the feeding tube. With the Farrell valve in operation, these occlusions may not be overcome, and formula will back up into the Farrell bag. If formula begins to back up into the Farrell bag, close the white clamp located on the line above the Farrell Y port and wait several minutes to determine if the pump can then overcome the occlusion. Make sure the white clamp above the Farrell Y port is closed and the blue clamp below the Farrell Y port is open. Considerations: if the patient's stomach is bloated or swollen due to pressure from inside, then manually reduce the pressure with a syringe before using the Farrell valve system. If a feeding tube occlusion is suspected, close the blue clamp and disconnect the Farrell valve system. Check for occlusions in the feeding tube. Once the occlusion is resolved, reconnect the Farrell valve system. If a large volume of formula or nutrition is in the Farrell tubing and bag after removing a blockage, then adjust the white roller clamp to prevent the formula or nutrition from free-flowing into the patient's stomach. The Farrell valve system is available with both end-fit and non-end-fit connectors. The end-fit connectors are purple and the non-end-fit connectors are orange. This video was created with an end-fit product with purple connectors, but be assured, if you're using a non-end-fit product with orange connectors, you can follow the same simple steps in this video. The white roller clamp helps control the speed at which the formula or nutrition is gravity-fed into your stomach. The Farrell valve system can be used with neonatal, pediatric, and adult patients. To use your Farrell valve system, first start by hanging the Farrell bag above the pump. Ensure the Farrell bag is above the pump is above your stomach, and your stomach is above the Farrell Y port. Close the white roller clamp on the Farrell tubing. Then, connect the pump set connector to the Y port of the Farrell and start the flow of the formula or nutrition. The formula or nutrition should move down the Farrell tubing toward the open end. Allow the formula or nutrition to fill the Farrell tubing until it reaches about 1 inch or 3 centimeters from the end of the Farrell tubing, and then close the blue clamp on the Farrell tubing. If the patient has a low-profile feeding tube, before starting the flow of formula or nutrition from the pump, attach the Farrell tubing to the extension set, which is not attached to the feeding tube, and allow the formula or nutrition to fill the Farrell tubing and the extension set until it reaches 1 inch or 3 centimeters from the end of the extension set. Then close the blue clamp on the Farrell tubing. Allowing formula to go into the extension set before starting to feed into the feeding tube prevents additional air in the extension set from being pushed into the patient's stomach. Connect the Farrell tubing to the feeding tube, or the extension set to the feeding tube. Open the blue clamp on the Farrell tubing to allow flow to continue. Open the white roller clamp. The Farrell valve system is now ready to use. Before disconnecting the Farrell valve system from the feeding tube or extension set, close the white roller clamp and the blue clamp.